Welcome back to Health Law Pulse, the podcast where we explore how healthcare, leadership, and law intersect in the real world. I'm your host, John Rhodes, healthcare attorney and founder of Health Law Counsel, LLC. I am very excited about today's episode. The conversation is about something we don't talk about nearly enough in healthcare, and that's what happens beyond the clinical training. Medicine does an exceptional job of training clinicians to be technically excellent, but it doesn't always prepare them for everything that comes with the job. Handling uncertainty, navigating failure, leading teams under pressure, and carrying the emotional weight of high-stakes decisions. Those aren't just personal challenges, they're system-level issues that directly impact patient care, communication, and ultimately risk. My guest today is Dr. Danny Eiferman, a trauma surgeon and professor at Ohio State University Medical School. He's also the author of Cut Open, A Surgeon's Stories of Loss, Resilience, and Growth, a book that I highly recommend. It takes a candid and deeply human look at the realities of medicine that often go unspoken: complications, self-doubt, leadership, and resilience. In this episode, we talk about the gap between training and reality, what resilience actually looks like in practice, how leadership shows up in high-pressure environments, and why psychological safety isn't just a cultural concept, it's a patient safety issue. I have no doubt you will enjoy this episode. This is Health Law Pulse. Okay, Dr. Eiferman, Danny, thank you for joining us on this episode of Health Law Pulse. Very, very honored, very privileged to have you join us today. Thanks for carving out some time.
Thank you for having me.
Absolutely. So, Danny, you're a practicing trauma critical care surgeon right now. You're also a professor at the Ohio State University Wexner Medical Center. But also importantly, and we're going to dive into some of the topics here. I know you are an expert in this area, and I'm very, very interested in hearing what you have to say. You've recently written a book called Cut Open, and it's about your personal story, but also the stories that you've sort of built along the way in terms of loss, resilience, and growth within the practice of medicine. So much looking forward to hearing more about that. First, though, do you mind just tell us a little bit about yourself, your background, a little bit about the book, and we'll kind of dive into some of those topics after that.
Yeah. So, like I said, I'm Danny. I'm a surgeon. I'm in my 16th year in practice. I'm what's known as an acute care surgeon. I'm board certified in general surgery and critical care surgery. I had an idea for a book back when I was training. There's college, then 4 years of medical school, and then you choose what you're going to go into. I chose to go in surgery, which is 5 clinical years. And around that time, I read Atul Gawande's book, Complications, which I'm not sure if you're aware of or not, but it was a fantastic book. I found my notes the other day. I think during my third or fourth year of residency, I scribbled down some notes that I was going to write a book someday. And I read them the other day, and I'll be completely honest with you, it was horrible. I would not read that book at all. And life got busy. And God, I want to say maybe I wrote the first chapter 6, 7, 8 years ago and was probably writing a chapter every 6 months or so. And then finally finished it 2025 and it got published in 2026.
Well, great. Looking forward to it. I think I told you a little bit this before we started, but my wife is a bedside nurse and often comes home uh, just emotionally exhausted from being pulled in all kinds of different directions, dealing with very acute and chronic issues throughout the day. And and so this concept of how to deal with that in a clinical setting, I ordered that book for her yesterday, so I'm very much looking forward to this, and I know she'll look forward to hearing this episode. And I'll bring this up at the end, but listeners that want to know more about the book, they can go to your website, integritysurgery.org. They'll get it on Amazon. Again, it's Cut Open, A Surgeon's Stories of Loss, Resilience, and Growth. Please check that out. But first, I want to talk a little bit about the gap between clinical training and reality. In the very first episode of this podcast, I had my brother on, who's a family practice physician. He's currently the associate dean of clinical affairs at an osteopathic school, and we talked a little bit about this, about what does medical education look like? What are they training on? The technical piece, but also the sort of the emotional piece, the psychological piece, very much an important part of a physician's overall training. Medicine trains people to be technically excellent, but my take on some of the things that you've written, not necessarily perhaps to handle everything that comes with the job. So you talk about this gap in training. What is missing from training today in your opinion?
That's a great question. I'll start with a story of my first day of being an attending surgeon. So I had done my medical school, my residency, my fellowship. I was I was here. My very first patient that the trainees came up to present to me was this social and medical disaster where the patient was being non-compliant with their therapy. There was this friction between the patient and the nursing staff. There was friction between the nursing staff and the residency team, and nobody could really make any progress. And they turned to me and they said, "Can you fix this?" It's like, "What do we do now?" And I'm sitting there thinking, I'm all board certified, ready to go. It's like, I know the 5 types of peptic ulcers. I know the classification for diverticulitis. And that was my very first patient. And I quickly realized that a lot of the skills that I needed to be successful in this job, I was never taught how
Mm,
to do. And I've come up with a number now that I think it's about 50-50 between clinical acumen, reading x rays, doing surgeries, and communication skills, team building, listening, things like that. And that I think we need more of in all industries. I wouldn't just say in healthcare, but learning how to listen to hear. Most people listen to respond. What am I going to say next? Learning how to be curious and get to the root of things. That's what's missing. But there's so much clinical volume that there's sometimes not time to get that in to the medical education. And so that's my answer for you of what we need more of.
yeah, that is really great. So those non-clinical skills, like you said, listening, kind of understanding the situational awareness, is that fair? Like understanding what is going on around you?
So, yeah, there's a great article that I read one time. I think it was in Scientific American. And I put this in the book. It is, what's the number one trait associated with being a great healthcare provider? And you can guess different things, but the answer was curiosity. And if you think about that, when you go in and you say, "What is it that's bothering you?" or "Tell me more about that," or "Where does it hurt?" You're demonstrating your curiosity. And what you're doing when you do that is you're saying, "The most important thing that I have," this is chapter 2 of my book, by the way. It starts off with, "What's the most important thing that you have?" is your time. I believe that time is the most important thing that you have. And when I go and I say, "Tell me more about that," what I'm doing is saying, whatever's going on with you, you are worthy of my most precious asset right now is my time. And so when you sit down and you make eye contact with them and you are an active listener and you're engaged with them, those are the type of things that we need to be. That's what leads to great communication. That's what leads to building trust with people. And when you do that, that's when you can start making progress towards whatever goal you're trying to accomplish.
Yeah, so that's super interesting. I love those ideas, those concepts, and I agree with you. Like, and you're right. That's not just a healthcare issue. Like, your most important asset is your time, regardless of what industry you're in, and making someone. So when I hear that, Danny, I hear um, making someone feel valued and that you have their best interest in mind, which goes a long way in terms of developing that trust and confidence.
That is our human beings, our number one desire is to feel valued. That's our number one desire. And when we don't feel valued, that can be in a bunch of different arenas. That can be in the financial arena. This person's getting paid more, than me. It could be by status. This person got a title. Those are tend to be extrinsic motivators, which tend not to work very well in the long term, just FYI. But when you feel valued, my opinion is important, you will engage. And not only will you engage, but that engagement usually leads to you going above and beyond the so-called discretionary effort. And that is what leads teams to be great at what they do. The what I have to do and what I'm willing to do line. In healthcare, it's easy to define. That's going back and seeing the patient one more time or re-explaining it because it didn't seem like they quite understood, the first time, different things like that. But that to me is the secret sauce right there.
I love it. Why do you think it, you mentioned this earlier, but why do you think the system has historically overlooked these very, very important skills? Is it just a matter of volume? I mean, we're just so overloaded from a volume perspective?
I would say in general, my opinion just coming to the top of my it's not what's valued. Like being a great listener does not come back on your annual performance. How many patients you saw did, how many RVUs you generated, how many operations you did, what's your infection rate, and all that stuff. And I mean, I would say people write reviews of people and things like that. But to be a great listener takes time. And when you're under parameters of, how long is each clinic appointment's going to be, how many cases can we do in the OR, there is an option or you do need to be efficient, but that's the dueling priorities right now. And I wouldn't just say that it's just for healthcare, right? How much time can I spend mentoring this person versus getting my own work done? Things like that. I don't think this is specific to healthcare or surgery.
Yeah, no, that makes a ton of sense. I want to talk a little bit about the term resilience, and you use this in your book quite a bit. It's talked a lot about in healthcare, not just in healthcare, but it's almost a corporate buzzword, so to speak.
Yeah,
What does it actually mean in practice? I mean, the theory of
yeah.
resilience versus operationalizing or putting it into day-to-day practice.
Yeah, that's a great question because everybody should have a definition for words like value and culture. I think resilience is another word. You should be able to define that. Resilience, to me, I have this graph that I show when I give a talk called There's No Crying in Surgery, which is a spoof on the There's No Crying in Baseball to try to help people build resilience. And that is you're functioning at this level right here. Something bad happens, you are now functioning at this level right here. Okay. If
Mhm.
you don't get back to your baseline level, we call that PTSD suffering. If you get back to the level of functioning that you were at after bad thing happened, that's resilience. What's talked about less, that I'm going to get a shameless plug in here for, is actually functioning at a higher level after that bad thing X happens. And that's known as PTG, which is post traumatic growth. Almost everybody knows what PTSD is, post traumatic stress disorder. And we've seen that we use words like burnout. In severe cases, we see it with addiction and mental health problems. But it's actually not just about being resilience. If you notice the subtitle of my book, it's about loss, resilience, and growth. How am I going to get better from this? But anyway, resilience, the straight answer to your question, resilience is getting back to the level of functioning you're at before bad thing X happened.
I love the concept of PTG, post traumatic growth. It makes me think, Danny, of I listen to a number of sports podcasts, and they're always talking about, okay, when you're evaluating sports talent, let's just say quarterback. I don't care what you do after you throw a great touchdown. I care
Yeah.
what you do after you throw a pick six, right?
Yeah.
How do you react to that? How do you react to that adversity? Do you pick yourself back up and do you learn from it and do you get better because of it? It sounds like the same concept. Are you able to learn from that? Are you just going to kick yourself while you're down and just not progress or grow? Is that it's sort of the same concept?
You can use that. You can use I love sports as well, and we could spend the next 45 minutes, talking college basketball, which is my love, if you want to. But it's not just that, but also think about relationships you've been in. It's
Mhm.
easy to be lovey-dovey when everything's going well. How are you when you have an argument? Things like that. Can you still be kind and generous? Things like that. So yeah, the same thing is true if you throw a horrible interception, are you going to sulk? Or my son's a baseball player. He didn't get the call from the umpire that he wanted. Thought it was a strike. It was a ball. Okay. What are you going to do for the next pitch? Things like that. Healthcare, surgery, it all. You have a complication that did not go the way that I wanted it to. Are we going to throw in the towel or are we going to do a deep dive and say, okay, how can I get better?
Yeah, that's great. I want to talk a little bit how do you do that? So uh,
How do you get better?
it is really kind of easy for us to talk about, and it makes sense conceptually. But what
Yeah,
most effective ways clinicians can recover after having those difficult outcomes?
sure. So I'll give you the number one easiest, and I can do it with a story, and that is I'm going to start with the end, then I'm going to tell the story, and then I'm going to repeat it at the end for the listener. The end is you have to have an inner circle of people who do what you do, be there to comfort you.
Mm,
And what I mean by that is, so I start the book with the worst complication of my career. and really difficult on me. And I always say, at the time, I was married 16 years. My wife, my best friend, mom of the kids, all that stuff knew that I was sad, but didn't understand the anatomy of the case. She's not in healthcare, why this happened versus that happened. And then I talked to my former chairman and told him the story. And when he went on to tell me um, a story of a complication that he had, and I said, "That happened to you?" He goes, "Yeah, it happens to everybody." That's when I actually feel like my healing began. So, starting with repeating what I said at the beginning, finding comfort in people who do what you do is the number one way that you can bounce back. At least in healthcare, that has been proven. So for me, it's other people who do surgery, do the types of surgeries that I do because they have the empathy up for me. And just being able to talk and express your emotions and hearing somebody say, I understand, I support you, I have empathy with you. That, believe it or not, is actually the number one thing that's been shown to help people recover.
That resonates so much with me. So going back to my wife again as a bedside nurse, he comes home with just the craziest things that happen at work, whether it's, someone has passed away. She works in kind of an older folks with chronic conditions unit. So she sees people pass away quite a bit, part of the treatment or their care. So, like someone threw a walker at her, so just like some of these just kind of outlandish things. And yeah, I hear that, but I am in healthcare, but I'm a lawyer. I have no concept of really what she goes through on a day to day basis. And so she recognizes that. You couldn't even imagine what it feels like because it is so emotionally traumatic for her. But when she talks to other nurses who have been through that situation, it is very much healing for her. So that completely resonates with me. I'm sure it does with anyone who's practiced medicine or been in any sort of clinic setting.
You also have to, there's what I call learn to talk to yourself nicely.
Mm.
So losses hurt us more than wins do. This has been shown over and over. And the number comes out to be about 2 to 2.5x. And if you ask anybody in surgery, what's your most spectacular case? They all lead off with a complication that they've had because those are what stick out in our mind is that the losses hurt us more than the wins do. And with that, our brains can get into a very negative spiral when bad things happen. This happened. I must also be bad at this, and I must also be terrible at that. And you go down, you have to be able to learn to talk to yourself nicely. Things like, that did not go the way that I wanted it to go. It is not what I intended. I have a lot of skills. I've trained very hard to get those skills, and I have the ability to help a lot of people. This one did not go the way that I wanted it to go, but I'm going to go out there and I'm going to help the next person instead of I'm throwing the towel in and I'm never doing this again. You want to go back to things that aren't taught in medical school and listening and all that stuff. I would say decades for me to try to get good at that skill. I can't say I've completely mastered it yet. I still got some room to grow there, but I'm learning to talk to myself nicer.
That's so important. That's really great. That's really great. Well, Danny, I want to shift gears a little bit and talk
Sure.
about leadership, especially in the high stakes environments. You're in acute surgery and where the stakes are really high. I mean, we're obviously life or death in many situations. You talk a lot about leadership without a title. What does that look like to you in a clinical setting?
Everybody, pretty much no matter what you do in healthcare, works in some kind of team. Now, are there some specialties, things like pathology and radiology come to mind where maybe it's a little bit more individualistic, but in general, if you're taking care of patients, affairs, you're working in a team. You have to demonstrate how you're going to get that team to function at a high level. And to me, that's being a leader. That is leadership, regardless if it's with a team of 3 people that we're rounding with today, or whether it's a group of 15, but everybody does things with others. And in order to be successful, you have to be great in making that other person feeling comfortable And so that they will want to go and give their best effort, be engaged with you so that your team can function at the highest level.
So is that what separates effective leaders?
Well, I think there's a couple things that separate effective leaders. Number one, those that can create psychological safety within a group are usually the best leaders. Those are the ones who are able to invite in dissenting opinions
Mhm.
and admit what they're doing wrong. And people love that word psychological safety. They'll say things like, this is a safe place. What happens in Vegas stays in Vegas. That doesn't do it. And if you want to look at what actually does do it, it's one of the things that I already mentioned a little bit earlier. One, the number one thing that makes it you say is being a great listener.
Mhm.
Okay. Not talking, but listening. They use the term ostentatious listening. I'm saying back to you the last two or three things that you did. I'm making eye contact with you. I'm nodding my head, things like that. Because again, when I'm listening, I'm saying you are worthy of my most important thing that I have right now, and I value your input. Two, the other thing that's been shown to make teams safe is when everybody in a group participates about an equal amount. They call that equality and conversational turn taking. That grows psychological safety because you're telling each member of the team, I value what you bring to the table. And so that's one of the biggest things that I feel like I can do as a leader in a team. I'll give you an example on rounds. A lot of times I'll ask a question, should we give this person a blood transfusion or should we take the breathing tube out? Let's vote on it. Okay, everybody has to vote. And then afterwards, we're going to adjust, why do you think that we should stop antibiotics? Why do you think that we should not feed them today? And all that stuff. And then everybody gets to participate. So that I think is one of the biggest things that great leaders do. They're great listeners and they engage everybody. When that happens and the group feels safe, they will bring out their best ideas. They'll be willing to take a risk because they're not worried about getting embarrassed or made fun of. And that's usually when great things happen.
I love that. Staying on this topic of psychological safety,
Yeah,
is that how leaders create those environments? Is it listening, engaging, encouraging participation by everyone and not shutting people down, but kind of going through the analysis and being encouraging?
I would say yes. They say the best leaders are the ones that have multiple leadership styles. And there's some great work out there on the different leadership styles. And there's six of them, at least the ones in a course that I teach that talk about. Three are resident styles. People are attracted to them, and one of them is a dissonant style. Resident styles are things that people who are described as visionaries, coaches, democratic leaders. Dissonant styles tend to be things people who are pace setters or direct, you just follow me and do what I say. In order to be effective as a leader, they say the ratio has to be 3R to 1D. You have to be really good at three resonant styles, but you do have to have one dissonant style. Because there are times I tell people in surgery, when I get into a bad case, that is not the time to be asking everybody's opinion. How you doing? Are you growing right now? It's like, listen, I'm captain of the ship. Put your finger right here, and we're going to do this, my way. There is a time for that, but you also have to be able to meet and see where your teams are and use that leadership style. Maybe one person wants to be coach. Maybe one person needs to be inspired by a visionary. Maybe one person wants it to be more democratic or participative. If you can do that, then people felt heard or seen, and then you're valued. And when you feel valued, it's our core thing that we need.
I love that. Just to kind of go off of that, and when that environment exists, people feel safe. They're psychologically safe. They feel valued. There's an environment of listening and engaging and participation. I suspect that leads to better patient outcomes, better patient safety, right, and an overall better quality environment for patients.
Absolutely. And I'll throw one more in there. Way more fun.
Yeah, yeah.
It's fun working with in a team like this. I got this, you go there, ready, team on three. It's great, but everybody benefits. Everybody wins in that situation.
Yeah, that's so important, and I think it's important for people to take away from that. What I'm taking away is that it is important for fun. It is important to have an engaged environment, and it's not a healthcare specific thing. We all love being in engaged environments where we feel value, but the fact that it results in better patient outcomes and higher quality of care is critical, which again is at the top of reasons why it's so important to take these concepts that you're writing about and we're discussing here and putting them into our day-to-day practice. So very important. Well, I want to look to the future. Let's talk about the future of healthcare care culture. I think the culture of healthcare is changing in a meaningful way. We've talked about some of the problems, some of the gaps in medical education. What does the future of healthcare culture look like to you?
So I'm going to delve into something that I know almost nothing about, and you hear it everywhere. I don't know where AI is going in medicine right now. And I have a worry. My worry is that it's going to depersonalize things. I mean, I've even read things that maybe a bot could take all your symptoms and diagnose you with strep throat and you never talk to a person. I've also heard I'm going to get all this time back because AI is going to do my charting, do my billing, order your test, and I could spend more time talking with you on the things that matter. And I've heard some pretty interesting things. I think that's where we're going is trying to get the menial things or the things that, all the things that have to be in a note to make sure it gets billed at the highest or that you're in compliance with different things like that. What
Right.
if some of that could get cut out to get you your time back? I hope that that's where we're going. And whether that even be, I think of fields like radiology and pathology where, I mean, could AI read an X-ray or read a slide better than a human could? I don't know. Does that allow that doctor to then go work on research or something else cutting edge or train somebody? I hope that's where it's going. But I am so far out of what I know, but that seems to be what's dominating, at least what I'm seeing in like conferences that we go to and things like that.
Yeah, it's definitely dominating my legal practice.
Sure.
Something that comes up all the time, and so I really like what you said because we started this discussion by talking about, okay, well, why is there that gap in medical education, gap in leadership styles? And we talk about how conceptually these are all great and they lead to better team environment, better patient outcomes, and hopefully you're right that AI comes in and changes the culture in a way that it relieves clinicians from the kind of the administrative burden of doing some of those things that allows them to close that gap and spend more time with the patient and help them feel valued and fully give them of your time and dedicate that to them. So I'm with you there. I think that's great. Well, what gives you optimism about the future of medicine?
I mean, the technology is definitely advancing. The medications are getting better uh, right now. Those are the two things that come to my mind right away. Is that could we keep doing more to give people quality of life back with minimal side effects? That's probably the number one and two things that come to my mind right now.
Yeah, that's great. What do you think needs to change the most? Not just generally in medicine, but how we train clinicians, how we support clinicians. What needs to change the most?
Uh, I would the
You got a long list, it sounds like.
Yeah, no, I would probably say the most things that like the documentation burden for things that probably don't add a lot of value. I wish there's more that we could. I open up my inbox and say that I just had to write one. I didn't have the admission date clearly in my H&P. Could I please go back and open that up and put that in there? And
Yeah.
um, was this present on admission, not present? Could you describe what type of and all that stuff? And I don't think there's a ton of clinical value there. That's for administrative stuff. I do wish that we could clean that up a little bit because um, remember I told you earlier, everybody should have definitions of things. One of the things that I like the best is the word value. That's thrown out there a lot. Value to me is outcomes over cost. So the only way to increase value, you can do one of two things. You could increase the numerator, right? The outcome gets better, or I can decrease the denominator. I could lower the cost. Now, cost doesn't always have to be financial dollars. It could be things like time and things like that. So non-value add things are things that either decrease the outcomes or increase the cost, and value added things are the other way around. I think there's a lot of non-value add out there, especially in like documentation and things like that, where we're not moving the needle at all for patients or for healthcare. If we could get rid of some of that, I do think that there could be better things ahead.
No, that makes sense. And maybe that's where AI comes in. Who knows? Who knows?
I don't know. Again, that is so far out of what I understand. I'm just now getting to the point where in the clinics, AI, you can turn it on and it will kind of give you write a templated note for you. But again, I have heard things more for the primary care physician's office where it's going to do way more than that, as well as the compliance thing and making sure you're getting your screening X and Y and things like that. That's what I hope for, but that's a little outside of what I know.
Yeah, no, that's fair. But those are fantastic insights and thoughts. I want to get you out of here on this, Danny. I always end every episode with a lightning round, just a few quick questions for you.
Okay.
But before we get to that, my listeners know the lightning round is sponsored as always by Western Associates. It's a company that organization. It's a company that helps organizations create high quality brand merchandise and corporate products that are high quality. People actually want to keep it. If your organization is looking to elevate its brand through custom merchandise, go to westernassociates.com or contact Mike Eldridge at MELDRIDGE at westernassociates.com. All right, Danny, I'm going to get you out of this. What separates a good clinician from a great leader?
Wow. And that's supposed to be my first lightning round.
Yeah, it's gonna be fast.
Yeah. Um, so that is a fantastic question because there is something that's known as the halo effect,
Mm,
which is because you are great, you're a wizard in the operating room, you must also be a great leader, uh, and vice versa. I guess I would say those are two different skill sets, and you got to be a master of them both. So that would be my answer is that you can be one without being the other. Uh, and you need to have competency and capability in both arenas.
sure, sure. Okay, the first piece of advice that you would have for a clinician after their first major complication.
Find somebody who you trust, who does what you do, and get support from them.
Excellent. And finally, this is just as much for me as for everyone else. I'm always interested in books that you're reading right now, show you're binging, or podcast you're listening
Yeah.
to.
What I am going home to read when we're done here is I'm reading No More Tears right now. It's the story of Johnson and Johnson. Fascinating. And then my hero, who I wanted my book to be like, even though I am nowhere close to his level of writing, I love Malcolm Gladwell. He writes great books, and he's got his podcast as well. That's always right. Those would be my two.
Yeah, no, I love it. No, those are I do like Malcolm Gladwell as well. He's fantastic, both on the writing and on the podcast. They're very enjoyable. Well, Danny, this has been fantastic. A few takeaways that stand out to me from our very insightful discussion. First, great healthcare isn't just about technical skills. It's about how we clinicians think, communicate, and lead under pressure. I think that's really important. Another takeaway for me: some of the greatest risks in healthcare are visible. They're the ones people don't feel safe speaking up about. I think that's important. And finally, failure and complications are part of the reality of medicine. The difference, as we discussed, is how individuals and organizations respond and learn from those moments. And this concept of post traumatic growth, I really love that. How do we respond, not just to get back to where we were, but how do we grow and get better uh, because of that situation? So that's great. Thanks again for joining me.
Thanks for having me, man. I really appreciate it.
Appreciate it. This is great. Again, go out and look up Dr. Eiferman's book, Danny's book at integritysurgery.org, or you can do what I did last night, which is just get it on Amazon. Either way, you can find it. Fantastic read. Please go look at it. And just more of this great, very insightful discussion. And obviously much more detail in that book. So, at the end of the day, the quality of healthcare isn't just shaped by systems and policies, it's shaped by how people respond when things don't go as planned. And as Danny, you know better than anyone that there probably isn't a day that goes by that things go exactly as you planned it. So I appreciate your great insight and your instruction. I can tell you're a great educator by the way you explain things, and us lawyers, we need that. Thank you so much, Danny. Appreciate it. Thanks for joining us today.
Yeah.
I want to thank Dr. Eiferman for joining me today, engaging in this very important and interesting topic. A few takeaways that stand out to me. First, great healthcare isn't just about technical skill. It's about how clinicians think, communicate, and lead under pressure. Second, some of the greatest risks in healthcare aren't visible. They're the ones people don't feel safe speaking up about. And third, failure and complications aren't exceptions in medicine. They're a part of the reality. What matters is how individuals and organizations respond and learn from those moments. If you found this conversation valuable, I'd highly recommend Dr. Eiferman's book, Cut Open, which explores these themes in a much deeper and more personal way. You can find it at his website at integritysurgery.org or on Amazon. We'll include a link in the episode description. At the end of the day, the quality of healthcare isn't just shaped by systems and policies, it's shaped by how people respond when things don't go as planned. I want to thank all of you for tuning in to Health Law Pulse. If you enjoyed today's episode, please do me a huge favor and subscribe, leave a review, share with a friend. We are on YouTube, Spotify, and Apple Podcasts. You can also find links to these episodes on my website at www.healthlawcounsel.com. We'll be back soon with more conversations at the intersection of healthcare, law, technology, and leadership. Take care.